Well, there was some big news out of Pfizer today. The company saying that its vaccine is safe and effective for children aged 5 to 11. While there are still a few steps that need to happen before we get shots into arms of children, it's likely that this could be happening this fall in Canada. So this is going to change the game for many, but it's probably going to also be causing some issues as well that the federal government and our provincial leaders are going to have to deal with. So Dr. Saxinger, what does this mean for the virus and our schools?
Well, I mean, clearly schools have been a focus of a lot of concern and attention during the entire pandemic, and there has been a lot of dissension as to whether or not schools are safe or not, how to make schools safe, whether transmission in children actually drives transmission in the greater community. And to be honest, the weight of the evidence does suggest that children are less likely to get severely ill, are slightly less likely to spread it to others, and that in general, schools can be made to be reasonably safe as long as community transmission is okay. Now, if we can vaccinate school-aged children, right now we can vaccinate 12 plus, but if we can vaccinate the larger group of school-aged children, this would make school exponentially safer for everybody. I think it would decrease a lot of stress amongst a lot of parents, but a lot of people still have reservations about the COVID-19 vaccines. I think that's due to both misinformation and active disinformation. And I do suspect that although a lot of kids who have received their entire vaccine series to date, there's very good uptake of vaccination amongst Canadian children, there might be more hesitancy around these products. And we'll have to make sure that we're sensitive to that and that we're working with people to understand the recommendation and the safety.
I think that's a great word, sensitive. We have to make sure that we're sensitive when this eventually rolls out, likely in the fall. Dr. McKenzie, what problems could we see when it comes to vaccine hesitancy for kids, maybe from their parents, or mandates?
So I agree with Dr. Saxon there. The truth is, one of the most used cliches is from Wayne Gretzky about knowing where the puck is going, skate where the puck is going. And the problem with COVID-19 is we don't know exactly where the puck is going because COVID keeps changing. So we have to be careful. Now, we know that 5 to 11-year-olds are unlikely to die from COVID, but we know they are likely to get it. And we know they're going to end up in intensive care. They can pass on the infection, and they could be the group in which the next variant develops. So, I agree that the risks are much greater from COVID-19 from the vaccine, and Delta is so infectious. And I've just seen a presentation from the Ontario Science Table, which says that if we don't vaccinate 5 to 11-year-olds, it seems likely that the pediatric intensive care will be overwhelmed in Ontario. So from a community perspective, a population public health perspective, vaccination makes sense, but people make emotional as well as fact-based decisions, and all of the publicity about side effects is causing people to err.
All right, thank you very much. Lori, we'll get your last quick thoughts on this. Mandating vaccines for kids, it can cause a lot of problems, right?
I think that the legalities are going to be complicated, whether or not provincial governments choose to extend vaccine passports or provinces that mandate vaccines for schools. I think it will be interesting to see if they extend that to COVID. But whatever they do, I think that the governments need to get the messaging correct around this and not have it be political messaging, have it be evidence-based, factual messaging.
Absolutely. Thanks for that take. Thanks so much. More with the panel next hour as coverage of the federal election continues here on City News.